You know when you go to the doctor's office and they hand you that little cup? Ever wondered what's really going on with that sample? Well, today we're pulling back the curtain on one of the most common yet incredibly powerful medical tests out there, the urinalysis. It's a simple test that can tell us some pretty big secrets about our health. So let's dive in. So, what's hiding in your urine? I know, it sounds like a weird question, right? But your urine is basically a liquid snapshot of what's happening inside your body. It can reflect everything from what you ate for lunch to potential health issues that are just starting to brew under the surface. A urinalysis is simply the tool doctors use to read that snapshot. So, what is it exactly? Well, a urinalysis isn't just one single test. Think of it more like a three-part investigation. It starts with a simple visual check, then moves on to a chemical analysis, and finally, a deep dive with a microscopic exam. Each step gives us another piece of the puzzle to build a clear picture of your health. All right, so here's our game plan. We're going to cover what a urinalysis is, how you get ready for one, the step-by-step process of how it's actually done, how to make sense of the results, and most importantly, what those results can really mean for your health. First up, what is urinalysis? Honestly, the best way to think about it is as a window into your health. It's an amazing tool because it's completely non-invasive, and it can help spot potential problems long before you might even feel any symptoms. So this whole analysis happens on three different levels. The first is the physical exam. Super simple. We're just looking at the color and whether it's clear or cloudy. Then comes the chemical exam, which uses a special little strip to hunt for things that shouldn't really be there, like sugar or protein. And finally, the microscopic exam, where a drop of urine goes under a microscope to see if any cells, crystals, or bacteria are hanging out. Okay, let's talk about getting ready for the test. To make sure the results are as accurate as possible, there's a little bit of prep work involved, but trust me, it's really, really simple. The whole thing kicks off with the basics, good old-fashioned hand washing. A healthcare provider will give you a sterile container and walk you through exactly what to do. The main goal here is just to make sure no outside germs or anything else contaminates the sample and messes up the results. Now for the main event, how the test is actually performed. This is where a tiny plastic strip does some pretty amazing chemical detective work. It's kind of incredible. The process itself is pretty precise. First, you provide the sample, usually using what's called a midstream catch to get the cleanest specimen possible. Then that special reagent strip gets a quick dip in the urine and is pulled out right away. The next part is crucial. You have to wait, usually for about 30 to 60 seconds, to let the magic happen, for the chemical reactions to take place. Finally, you compare the colors on the strip to the color chart on the bottle. And this image shows you that final step perfectly. You can see the strip with all its little colored squares being held right next to that reference chart on the container. It's really just a simple color matching game where each one of those squares gives you a specific clue about your health. Okay, so we've got a strip full of different colors. What now? Well, the next step is reading the results. This is the decoding phase, where we translate those colors into real, meaningful health information. The science behind this is actually pretty straightforward chemistry. Each little square on that strip is coated with a different chemical. When it comes into contact with something specific in the urine, say glucose, it triggers a reaction that changes its color. And usually, the darker the color, the more of that substance is present. This chart right here is basically your decoder ring for the test. You can see the different rows for things like protein, pH, glucose, you name it. For each one, there's a whole spectrum of colors, showing a range from negative all the way up to a high positive reading. It's a super efficient way to screen for a bunch of different things all at once. So let's get to the most important part. What do these findings actually mean? We're going to connect these chemical results to potential health conditions. And we'll use pregnancy as a specific example to show you just how much context matters. This table really shows why context is everything. Take glucose, for example. If it shows up in the urine early in a pregnancy, it might point to chronic diabetes. But if that same finding pops up after 20 weeks, it's much more likely to be gestational diabetes. Same goes for protein. Early on, it could signal a kidney issue. But later in pregnancy, especially if there's high blood pressure, it's a major red flag for pre-eclampsia. Now, some findings are more consistent. Ketones pretty much always point to dehydration, and bacteria are a classic sign of a UTI. Now, this right here is probably the most important thing to remember from this entire explainer. An abnormal result from a urinalysis is not a final diagnosis. Think of it more like a clue or a big flashing signpost that tells your doctor, hey, maybe we should look into this a little more. It's the start of a conversation, not the end of it. This quote just nails it, doesn't it? From one simple, inexpensive little strip, you can get a whole world of information. It's a truly powerful piece of everyday medical tech. And that leaves us with a final thought to chew on. If a simple urine test can reveal so much, what other basic health checks might be holding powerful secrets? It's a great reminder that sometimes the biggest insights come from the simplest tools. Thanks so much for joining me for this explainer.